Research Podcast. I'm your host, Dr. Rand, founder of Diverse Research Now. And today we will hear the voice of Dr. Denise Bronner. She is CEO and founder of Impactful Ventures. She has roughly 15 years of organizational thought leadership experience within the global healthcare space and has held various roles in academia, consulting, pharma, and venture capital. I am super excited to have Denise here finally on the talking to us. So let's jump right into this important conversation. How are you doing, Denise?
Amazing. I cannot complain. It's been good.
Yes. So I want to start and ask you to share your story and how you got started in the industry and what you're doing.
So I'm originally from academia. So I have a PhD in microbiology and immunology. And while I was doing my graduate program, I was like, I like science. Do I really want to do this long term? So at the time when I was in grad school, they didn't really tell us about careers outside of academic sphere. It was like, if you wanted to go outside of it, you were going to the dark side. So I was like, you know what? I'm okay with that. I can go. But I didn't know what I wanted to do just yet. So I still went and did the academic postdoc, did that at UC Davis, left Michigan. And then during that time, I did a business development fellowship. And that's where I got introduced to the world of business. And I was like, okay, this is what I need to do. So participated in a Big Bang business competition, left there, went to consulting, did that for about a year. Then I got pulled in or headhunted by one of my clients, moved over to J&J, was there for 4 years. And then I said, you know what? Maybe I need to go off and do my own thing. And that's why I started Impactful Ventures last year.
Come on now.
4 career pivots.
Come on. That's okay, because reinvention of ourselves is okay at any point.
Yes.
We have to I feel like you have to pay attention to what the universe is leading you to do. Like you need to find your passion. I'm super big on finding our passion and our purpose. In this. So
I gotta say, I feel like when people say they pursue their passion, they get told, well, is it really gonna make you any money? And as far as I'm concerned, it's like a lot of those passion projects really can turn into something that can be big. But a lot of people put these type of social entrepreneurship or passion type of things to, oh, it's nice. You're trying to be nice. But it's like there's a lot of things that can be done to have great economic impact. So.
That's right. And so that's what we're doing here. I mean, that's what I have ventured out to do as well with Diverse Research Now, and really leading and in the community, sharing this passion for health equity and clinical research, which is why we're here today. To talk about health equity and clinical research. Tell me, where does that start for you, health equity and clinical research?
So health equity for me really started from my own personal experiences. So watching my dad go through his patient journey with multiple myeloma, watching my mom go through hers with her health issues, and then thinking about overall my own that I've had with having several hernia repairs, mesh removal. These are things when you're engaging within the health community that you're like, okay, I see how doctors engage with patients. I see some of the biases that are there. And then when I worked in consulting and in pharma, seeing the ideas or assumptions that they had about different groups, I said, okay, this is why having people who look like you in those spaces and those decision-making roles are important. Because when you think about how a trial is designed or how a therapeutic came to be, if you were not a part of that, there's no way for the data to say if it works for you, if this is right for you, are you different, are you on track? So for me, it's that's where it begins. Regardless of who you are as a person, and I think a lot of times people want to hear equity or diversity, they tie it just to race. And it's you guys have to think bigger than that and I've had a few people when I was working in pharma where someone says, well, we were talking about Europe and they were like, oh, well, US, you guys are always so race centric and all these type of things. We're diverse. And I'm like, exactly. You guys are diverse, but you guys keep thinking about it in a race or ethnicity format and not thinking about the fact of someone being from a rural area. A veteran, disabilities, male, female. You guys are not thinking about all these other things, socioeconomics. To me, it's when you think about health equity, it is, if you go to see a doctor, are you going to get equitable care, regardless of what you look like?
Exactly. Awesome. You said that so good. I love the way that you said that so eloquently. That's what we're trying to do with Diverse Research Now. We really are trying to get out in the community to share with the community about clinical research, clinical trials, and really help to push health equity and increase that equity in the community. Tell me, what do you do any community work?
So I have, as far as like with volunteering, but I would say indirectly I work within the community through the companies or my clients that I worked with.
Okay.
We also did some community work when I was back at J&J, where we were working through the sites. And with some of the vendors that we partnered with, we would do these community events that we would do. I think now that I'm on my own, I don't have as many restrictions. So I can choose to do that.
That's good.
One of the ways that I'm doing it is partnering with it's a STEM preparatory school in LA. So I'm going to be going there to talk to the kids, but also being a judge for one of their STEM competitions they have coming up, but then also connecting them with industry leaders so that the kids can go on field trips to learn about these different careers beyond just a doctor, beyond just being a scientist. Like, what else can you do out there?
That's so funny that you say that. I just was at an event today with UCSD and was talking to someone about this topic, about really sharing with the younger generation about this field. And they're the ones that's going to take this and run with it. They're the ones who's going to really implement the things. I mean, we're not too old, but we might, we're not too old. We're not too old. So I said that because hopefully we'll get a chance to see the change.
Yeah, I gotta agree with you, because I was thinking back on when I was a kid, when you think about what you could do with a science career, it was really just you were either a doctor. You knew about some scientists, but you didn't see a Black woman as a scientist, right? You would watch all these old programs on PBS, you watch it on Nat Geo, and you would see them, and you're like, yeah, none of them look like me.
Yeah.
And I remember I told my folks when I was younger that I wanted to get a PhD, and they were like, okay. And neither one of them have gone to graduate school, right? They were like, we have to figure out how to do this. But I think it's interesting when you talk to kids now because of the internet, because, we grew up before the internet.
Before the internet, guys.
Before.
We didn't have none of that.
None of it. But now kids can look this stuff up. So so how can I make myself visible for them so that they can have an example?
That's right. Oh, that is so good. I love that. That's why we're on all networks. We're on all platforms, IG, Facebook.
Yes.
Definitely TikTok. Hopefully it stays.
Right. That band was like, I don't know about that.
Girl, that band was like a second long.
Heck, wasn't it? I'm like, man, no, there's no.
So we'll see what happens with TikTok. But I mean, it really is a great platform to get the message out, to get our vision and our mission out there.
Yeah. What I think is interesting is social media and the creator economy is such a big thing right now. That a lot of people only put it with consumer type of sectors, but I feel like pharma and medicine should really lean in more, because so many people have personal stories to tell about their patient journey.
Yes.
And there's a way to influence people in a very unique way where you can control the misinformation that's out there. But pharma is a little scared to do so. I think there's also the legal part of it too.
Yeah,
right? Where you have
it's so much red tape, it's policies.
It's a lot of policies, but I feel like there's a huge market for it. And we're starting to see some startups that are moving in that space to kind of pull in influencers. So I do think we're going to see a huge difference with that.
Okay. Going back to what you just said about highlighting patient stories. Yeah. That's, of course, one of the big reasons why we had started this podcast, to highlight patient stories and really get the information out. We want to share those stories in the community. So we have pharma watching this podcast, listening to this podcast, but then we also have community members that's listening to this podcast. So tell me, as a patient and being a caregiver, because you're a caregiver, what would you want the community to know about research? That's one of our biggest things that we're out there in the community kind of sharing and bringing awareness. What is a good piece of information you could share?
I think the biggest thing is people are more willing to participate than you think. I think the biggest part for me is there's this assumption that certain demographics are not interested, they have low trust, that they wouldn't be compliant. But what we're seeing is that a lot of these patients are saying, you've never asked. So there was a layer report that GCI Health had put out last year, and they were looking, I think they had interviewed 500 Black women. 73% of them said they had never been approached about a clinical trial.
Wow. 73%.
73%. And I said, well, I have never been approached, and I've worked in this industry. My mother has never been approached. That's 2 generations. And I know for a fact my grandmother never has. So here you have 3 generations of women who could probably provide a good amount of data to inform the industry, and yet no one's asked. So for me, it's this assumption that just because a person's Black or Hispanic that they wouldn't be willing. I think it's a disservice. So I tell pharma all the time, you have to go out there. But they're like, well, we went. No one cared. It's like, because you can't just show up when you need a trial. You need to be there all the time.
Exactly.
So those are the two pieces I would say. Be consistent, be ingrained in the community. Not just show up when you need something, because we know people like that who come in and they're like, oh yeah, I came around because I want some money from you. Don't be like that, pharma.
Don't be like that.
And the other thing is just ask. Talk to them about it. And if they turn you down, still give them the information, because you never know. They might share that with someone else. Or down the road, they might say, you know what, I'll check it out.
Yeah. One of our past guests, she has done so much work in the community. Her name is Mary Futrell. She's from Chicago. One of the things that she wanted pharma to take away at events, to pay attention to the leaders in the room. Sometimes amongst the community, there's people that are influencers in the community.
Yes.
So pay attention to who those people are at certain events, which I think is a great point to make. So we're going to wrap it up, but do you have a lasting thought that you want to share with pharma? I know you just kind of gave them some good tips.
Yeah.
What do you want them to know as we continue this important work?
Oh, I think the biggest thing is with the current administration, and we see a lot of things being pulled down that are on certain topics related to diversity, equity, and inclusion. I think the biggest thing is, yes, those things may be being removed, but that doesn't take away from the fact that you should still be doing these types of things.
Right.
So the biggest thing is that you have to think about who your end customer is. So if we take it out of this moral compass type of view and look at it as a business opportunity, you, by pulling back on that, are reducing your chances of being able to convert those people as customers, because your data doesn't reflect them. You weren't including them in any of that communication. And now they're like, well, why should I even buy your product? Why should I even talk to my doctor about your therapy? You didn't think of me. So put it in the context of business. Think about this as an opportunity for economic profit boost, thinking about how you can change or maintain a strong perception within different communities. And that's what we need to be doing, even with these things being removed. That's the last piece that I would say.
Oh my goodness. Thank you so much. Yes. So we don't want pharma and our partners to stop the work. Pretty much. No matter what happens with the administration, what's happening in politics, this is important work. Good science is inclusive science, our tagline of ours. And we have to continue to make it inclusive, because that is just what is best for science. Is that we have to have a good representation of everyone in these trials. And so don't stop the work. Please don't stop the work.
Yeah, you definitely don't want to do that. It's sad when you look at trials where they're like 80-90% white. And then a doctor has a patient say, does this therapy, will it work for me? And the doctor goes,
they can't really say.
I can't really say. That's sad. And I don't want that to continue.
It's scary.
It is scary when you think about it.
Well, thank you so much for this conversation. It was great. And we might come back with a part 2, because we like Denise. Thank you so much.
Yeah, no problem. Thanks for having me.
You're welcome.